All right, so we're now moving on to speech disorders. Just allow me to, yeah. So speech disorders are explained in the same chapter with thought disorders, because again, remember, you assess your patient's thoughts through the speech. But when we talk of speech disorders, we are talking about exclusive speech-related issues. We're not talking about the thoughts now. Okay, so we've got stammering and stuttering, we've got mutism, we've got talking past the point, which is otherwise known as Voiberraden, that's the German term, still being used. We've got neologisms, schizophasia, which is a special kind of speech issue, and aphasia itself. So in stammering and stuttering, the normal flow of speech is interrupted usually by pauses or repetitions of certain fragments of words. There could be tick-like movements associated with speech, and some grimacing aspects as well, or part of a word can be repeated, over and over again. So stammering and stuttering are basically the same thing. It's just a spelling issue in terms of where the English is being used. One is Australian, one is American or British or something like that. Same thing, okay? Stammering is usually seen in childhood and can actually improve without any, interference, all right? Boys are more commonly affected than girls. Average age is about 4 years, and sometimes can be associated with an anxiety. So if you're socially anxious in the sense that you've got to present in class, you'll find you tend to kind of stammer or stutter more. But when you're talking regularly, or you could talk about the content of your presentation with somebody else, and there's no pause, there's no grimacing, there's no tick-like movements at all, right? Sometimes social anxiety or anxious situations in general tend to exacerbate it. Mmefanya oral exams, yes. When you are practicing na mwenzako, you're good, you remember, you know the answers. But when you're sitting there in front of the panel and they're asking you a question, and it's not like you don't know the answer, it's just getting the answer out is a bit of a struggle. So it's not a thought-related issue, it's, speech, purely, okay? Sometimes, though, some people have very significant issues in terms of social communication with stammering and stuttering, especially those associated with illnesses like Tourette syndrome, which is a tic disorder, or other tic and movement disorders. Sometimes we've had patients where at the onset of a psychosis, particularly acute schizophrenia, they can present with stammering and stuttering. Mutism is a complete loss of speech and not talking at all. Children can present with mutism, what we call selective mutism. So situations where they talk and situations where they do not talk. So you'll find at home, they're like little chatterboxes, great. But then when you put them out in public now, again, the anxiety issues kind of come in. New people, people they're not used to at school, that sort of thing, they tend to kind of not speak, right? In children as well, mutism can be a trauma response, especially severe trauma, most of the time physical and sexual trauma, and they tend not to speak. Children pick up on things. Remember social learning, right? Or observational learning. So in the home, if kuna conflict, and the way to deal with conflict is by not speaking to one another, then children pick up on that, and then they can present with mutism, right? So with children, especially when it comes to mutism, pediatricians are usually the first people to see the kids before they come to, psych, and most of them don't really need to come to psychiatry, psychology, unless it's mainly, trauma-related issues, or it's beyond normal shyness and normal social, fearfulness that the child is experiencing. In adults, there's this term they used to call hysteria, which is currently really anxiety-related issues, and what is that? Dissociation as well. But mutism can be seen in depressive states, okay? Can be seen in catatonic states. You'll do catatonia in general, sorry, as a whole, in detail when you do motor disorders, but also certain organic brain disorders. We've had strokes that are, on Broca's area, the speech area. Broca area in the parietal lobe is motor expression of speech, so expressive aphasia. But then instead of presenting with aphasia, which is difficulty in speech, they present with complete mutism. All right. So with organic issues, you want to look at where is the anatomical lesion and what other symptoms or clinical features do they present with, and it gives you a complete, clinical picture to make a diagnosis. Hysterical mutism on its own, though, hysterical, quote unquote, is quite rare currently because we've now moved from using the term hysteria to actual, anxiety disorders, different anxiety disorders, what they entail, forms of dissociative symptoms and what they entail as well. Severe depression, you want to look for poverty of speech, over time associated with the mutism. They also have something we call psychomotor retardation, where there is generally a diminished motor response or initiation of motor movement. So if they're sitting, you'll find throughout the whole interview, wamekatu in one position, and they're looking down, they're not really responding and that sort of thing. So there are different kinds of mutisms you'll read about, very easy to understand. Those associated with catatonic stupor and non-stuporous catatonia, those that are just very restricted to the way, someone expresses words, things like pure word dumbness, whereby the patient is mute, but they're able to read and write, So speech in itself, you need to understand, is not just expression of speech. It's also comprehension of speech. It's being able to read, write, understand, etc. Okay, so think back when you're really thinking of speech, you want to think about it in the form of language. So some of you speak more than one language, right? You're bilingual, essentially, English and Swahili. And you'll find when you're expressing yourself in English, for example, you tend to do much better than when you're writing it down. Okay, so that doesn't mean you have a problem with English. Those are just very different domains neurologically as well. Okay, so any one of those issues can be related to speech disorders. Then we've got talking past the point, like we mentioned, Vorbereding, whereby the content of the patient's response shows that they understand what has been asked, but they respond by talking about something that's associated with what has been asked. So don't confuse this with perseveration. That is a point of relevance. This is adjacent to the point, past the point, okay? So there's something we call approximate answers, where you ask the patient a question, sometimes like something as simple as, what's the capital city of Tanzania? And the capital city of Tanzania is Dodoma, but they'll say something like, Dar es Salaam, which is maybe close to Dodoma, or that sort of thing. Or you ask the patient, what is 2 + 2? And they'll tell you 5 instead of 4. So it's close to what would be the correct answer, okay? Neologisms are new words that are constructed by a patient, or they may be ordinary, regular words that are used in a new way by the patient, okay? So these are quite rare though, but we have had patients, personally, I've had 2 or 3 patients who have used, neologisms. So the thing about neologisms, though, is you need to go with the way the culture is moving. So back in the day, there are words that have undergone some changes. And back in the day, things like, telling someone, like, you're the shit, excuse my French, that's just an example, was not a positive thing. Okay. But now when you tell someone, you know what, you're the shit, it's like, yay, you're good, you are the person. We've got words nowadays that are like, I think a few years ago, people started combining 2 words together, like fleek. Women would say this about their eyebrows a lot, like eyebrows on fleek or makeup on fleek or something like that, right? So if you do not know, that's what the culture is currently, especially with you guys as Gen Z and your social media, and there's a whole new different language. When is going to for this site Urban Dictionary? So if you don't understand what's being said online, you go to Urban Dictionary and it'll explain it to you. So things like no cap, is a new thing. For real, no, not for real. The on fleek thing is one of those things as well. So you really need to know that this is something that is being used currently, even if it's not being used often. Otherwise, you'll end up thinking what your patient has is a neologism, really, but it's just you just didn't understand what they were telling you. And people speak like that, actually, even to their doctors. They speak like that to their parents, which is weird anyway. Then we've got distortion in the pronunciation of certain words as well. We've got explanations of certain words, like, for example, stock words. So an airplane or an aeroplane, a patient can describe it as an air car, or a flying car. Um, uh, uh, sometimes pregnancy brain can kind of give you, not necessarily a neologism, but it is different use of the stock word. Children do that as well. So children will rename animals because they can't really remember that this is a rabbit, so they'll tell you, the cat that hops around, or I remember when, this is a personal experience, not that it's a neologism, but when I was pregnant, I couldn't remember, in a pregnancy brain, I couldn't remember the term for spatula, and I wanted a spatula. So I told my husband, could you please get me the egg flippy thing? The thing that flips the eggs, yeah. So sometimes, like we've talked about in class, you'll find, a lot of these things are not necessarily, you know, actual psychopathology. We experience these as, regular healthy individuals, in different circumstances. Then we've got something called schizophasia, which is not a term we use currently, but when we talk of psychosis, when we talk of schizophrenia and schizophrenia spectrum disorders, as you've seen so far in psychopathology, it's a very complex illness, and it affects so many different domains neurologically. So speech naturally is affected. So there's a particular type of speech, excuse me, that is associated with people with schizophrenia. It is profoundly confused. It doesn't make sense, and you're kind of just trying to understand what it is that your patient is telling you. And now this is different than the intelligence deficiency that we saw with schizophrenia earlier on when we did disorders of intelligence, right? And we have this kind of unspoken little tip where for psychiatry, if the interview is confusing, like hella confusing, it is possibly a psychosis. You're possibly dealing with schizophrenia, right? So you'll read more of schizophasia. Please, like we talked about last time in class, you want to look at the neurobiology of these things. So which areas of the brain are affected, how they're affected, just basics for your level of, physiology, anatomy, and biochemistry that you've done in first year. And then finally, we've got something we call aphasia, which is a general issue related to speech, and aphasia we actually use to describe organic etiology, so more neurological etiologies. So we've got receptive aphasia, intermediate aphasia, and expressive aphasia. Receptive aphasia is difficulty or impairment in comprehending speech, right? So take home reading, which is part of your quiz for this topic, is which areas of the brain are affected when you've got receptive aphasia, and it's different types, when you've got intermediate aphasia, and when you've got expressive aphasia, which is motor aphasia. So you want to go back to your basics of the parietal lobe, the temporal lobe. You want to go back to Broca's area and cortical localization, the Brodmann's areas, which you've probably done in anatomy. Brodmann's area is 44, if I'm not mistaken. You want to look at Wernicke's area as well, and that corresponds to which Brodmann's area when you look at, cerebral localization. So that's pretty much it in relation to speech disorders. Yeah, thank you.